I'm a hematopathologist at Kingston General Hospital in Kingston, Ontario, Canada. And we are currently using the oncomine myeloid targeted sequencing-based DNA and RNA amplicon panel to capture molecular information and aberrations in myelodysplastic syndrome patients at our center, and also including those with acute leukemia, acute myeloid leukemia, overlapping MDS, MPN, and myeloproliferative neoplasms. We were interested in this panel that we have some experience with oncomine panels in the solid tumor realm. And so we have the infrastructure in place and experience in order to implement this assay. We entered into a research agreement to get early access to the oncomine myeloid version. And we were quite happy with it when it became commercially available. That facilitated our adoption at our center. In addition to familiarity with this technology and the availability of the platform, we were also interested in the combined DNA and RNA aspects. So we currently look for cytogenetic aberrations, karyotype, and FISH, for example, but the RNA aspect of the assay offers a focused look at areas of the genome that are prone to fusion, chromosomal alterations, up to 800 common chromosomal alterations that are seen in gene fusions. And so we can apply this aspect to complement the traditional cytogenetics and FISH. I can give one example, for example, where a patient presented with eosinophilia that was unexplained, and the NGS assay, the RNA side, detected a rare fusion involving the genes PCM1 and JAK2. This is a recognized fusion that occurs in eosinophilic neoplasms. And then this was followed up, confirmation by fluorescent in situ hybridization. In this case, the RNA aspect of the assay very quickly identified the driving force behind the eosinophilic neoplasm, and also identified a potential therapeutic target in the clinical realm. We do run the DNA side as well, and this covers 48 genes that are commonly mutated in myeloid neoplasms. And so we find this assay provides a very comprehensive look at genes of diagnostic, prognostic, and therapeutic relevance in our patients. We are funded in Ontario, Canada, for this type of testing for acute leukemia patients. At our center, which is a little bit smaller, our catchment area is about 500,000. We don't get enough acute leukemia cases to run this assay routinely just based on acute leukemia cases. And so our molecular director has been very helpful and accommodating in finding additional funding. And we've been applying this assay to patients with MDS and MDS MPN and MPN as well. And we've recently looked back at around the first 200 patients or so that we've sequenced with the oncomine myeloid assay to look at its utility in the real world. And we found that about 2/3 of the time that we run this assay is triaged by hematopathologists in conjunction with the clinical hematologist. And when we run this assay, about 2/3 of the time we get information that is actionable or utilizable in the clinical realm. So this includes helping to achieve or clarify the diagnosis on the prognostic side, helping to personalize and understand the molecular features of this person's cancer and the predicted outcome. And then in some cases, providing information about treatment prediction and offering guidance regarding the most appropriate treatment in these patients. We've also found with this assay, it's quite useful in determining clonality and clonal disease in patients with unexplained cytopenias who are not meeting criteria by the World Health Organization classification. And the finding of clonality in these cases can indicate to the clinicians that the patient it may be prudent to follow this patient a little bit more closely and repeat bone marrow investigations, for example. And so this entity in the space of near MDS is known as clonal cytopenias of uncertain significance, or CCUS. And research is showing that some of these people may harbor disease that really resembles low-grade MDS. It's just not meeting the traditional dysplastic criteria, and that over time, their propensity to develop a full-blown myeloid cancer may be very near or that of low-grade MDS. And so this type of molecular testing in this realm of unexplained cytopenias is another area we found it has been very useful. And these findings were published recently in the Journal of Molecular Diagnostics.